Good evening, everyone, and welcome to tonight's COVID-19 community conversation with Sacramento County Public Health. Tonight's meeting is available in numerous languages, so we're going to start off with a brief introduction from each of our interpreters. Interpreters, when I call you, if you could unmute and provide your introduction. We'll start with Spanish.
Buenas tardes y bienvenidos a nuestra charla en la comunidad del COVID-19. Si usted gusta escuchar esta charla en español, en unos momentos va a aparecer un glóbulo en la parte de abajo de la pantalla. Usted puede oprimir ese glóbulo y le va a aparecer ahí donde dice la palabra Spanish, y usted oprime ese botón para poder escuchar la interpretación al español de esta charla. Gracias.
Thank you, Kayla. And now we have Russian, Alexander.
Дамы и господа, добрый вечер. Добро пожаловать на очередной общественный разговор общественности, посвященный пандемии коронавируса COVID-19. Услуги переводчиков предоставляются сегодня вечером. Если вы желаете воспользоваться услугами переводчика, пожалуйста, нажмите на изображение глобусика в нижнем правом углу экрана и выберите соответствующим образом язык русский. Большое вам спасибо. Хорошего вечера.
Thank you, Alexander. And next we have Tagalog, Miguel.
Hello, magandang gabi po sa inyong lahat. Salamat po sa inyong pagdalo dito po sa ating talakayan. Tungkol po sa pampublikong kalusugan dito po sa lalawigan ng Sacramento. Kung nais niyo po na mapakinggan yun pong wikang Tagalog, magpunta lamang po kayo doon sa simbolo ng mundo. At ito po ay pakidiin lamang at pagkatapos ay diin lamang po yung Tagalog. At huwag niyo pong kalilimutan na magsumiti po ng inyong mga katanungan. Kung meron po kayong mga katanungan dyan po sa kwarto ng chat, at sasagutin po yan ng ating mga manggagamot. Maraming salamat po muli sa inyong pagdalo.
Thank you, Miguel. Next we have Mong Lor.
Nhớ dòng xe tại tòa trong này sẽ đợi ổn định có công bê từ lúc community hay cho khó khăn về nó bây cũng một lần mong nhà để lên thì xã lò nông nhớ trong đó nó nhớ trong họ cá này bỏ luôn lôm thọ này nhẹ cho còn tới này thế liền một tàu thế liền nó của xã lông mong chỉ ta lên đây bây một khó khăn này và nhớ trong họ cá như hay để lên từ xã một lần nông thọ này sau cho họ bây mà đi xài cho có là tàu chỉ ta lên tới dòng xe tại tòa thì ở trong này lúc sau mà nó nè ở trong đó.
Thank you, Lord. Next is Vietnamese, Tyler.
Chào mừng quý vị tới diễn đàn cộng đồng về COVID-19 được tổ chức bởi Cơ quan Y tế Cộng đồng quận Sacramento. Nếu mà quý vị có bất kỳ câu hỏi nào thì xin làm ơn bấm vào nút Q và A, tức là hỏi đáp, ở phía dưới màn hình của quý vị. Để mà đánh vào câu hỏi thì có thể sẽ được trả lời. Để chọn dịch vụ thông dịch, xin làm ơn bấm vào biểu tượng quả cầu rồi chọn tiếng Việt, tức là Vietnamese, để mà nhận được dịch vụ thông dịch. Xin cảm ơn quý vị. Thank you, Nick.
Thank you, Tyler. Next we have Mandarin, Angela.
嗨，你们好，欢迎上这个沙加缅度的这个COVID-19 健康讲座每个星期四，欢迎你们。如果有问题的话，请你们把它们放在这个 Q&A 上面，稍后这个他会抽查，然后呢会这个为你们抽出比较这个相关的问题，然后来为您解答。也欢迎您在下面有个地球仪，如果你们需要中文翻译的话，请你们在这个地球仪上面进入这个中文，那么我们会为您这个做同步的翻译。谢谢您。
Thank you, Angela. And Arabic, we have Ahmed.
مرحب بكم في مؤتمر الكوفيد 19. هنبدأ بشرح اللي حصل، وهنترجم لكم كل شيء عشان تتعرفوا على أحدث تطورات هذا المرض، وبعد كده هتقوموا بتقديم أسئلتكم وسوف نقوم بالإجابة عليها. حظ سعيد، ألف شكر. شكرا.
Thank you. And you'll also note that we have American Sign Language interpretation. We have Jordan and Cindy who will be rotating. So thank you to all our interpreters. So my name is Nick Morey. I'm with Sacramento County Public Health. I'll be your facilitator this evening, and we'll have a panelist. Our panelist will be Dr. Olivia Kasirye. She's the Public Health Officer for Sacramento County. We'll have Rachel Allen. She's an immunization coordinator for Sacramento County Public Health. And Dr. Stuart Cohen, Chief of Infectious Diseases at UC Davis Medical Center. Each speaker will have an opportunity to make some opening remarks, and then we'll move to the question and answer portion. I see some of you have already familiarized yourself with that process, but you can use the Q&A feature on Zoom to submit your questions. I do want to make a couple of notes. It's not uncommon for us to get more questions than we can handle during the time that we have tonight. And so we apologize in advance if we don't get to your question, but I will note that we do have a COVID-19 inbox that you can email if you have questions that we don't get to tonight. The address is COVID-19, COVID-19, there's no dash, at saccounty.net. Also, please note that it's not uncommon for us to get similar questions or questions about similar items. And so I'll do my best to try to group those in themes, and I'll do my best to capture the spirit of your question, but your question may not get asked word for word. And with that, I will, looks like our speakers are all ready to go. And so I will turn it over to Dr. Kasirye.
Good evening, everyone. Tomorrow, March the 5th, marks 1 year since the day that we declared a health emergency, and we have come a long way. We have a total of 93,947 cases of COVID-19 reported to Sacramento County Public Health. We did just pass a milestone. We've surpassed 1,500 deaths. We are at 1,506. The good news is that we passed the peak for the surge that started in November. And compared to the end of the year when we were seeing as many as 1,000 cases a day, we are now getting about 150 cases a day. So we are definitely past the peak and going in the right direction. On our dashboard, and I hope you're all familiar with the dashboard, so I won't go into all the numbers, but it shows that our case rate is 8.6 per 100,000. The case rate on the dashboard is updated daily, and that helps all the residents in Sacramento to know the direction we're going and to have an idea of how long it will take for us to actually meet the state criteria to move into the red tier, which is the less restrictive tier. According to the blueprint, the state blueprint, we are still in the purple tier. Our case rate, according to the state, is 12.0. I'll just note that it's different from what we have on our dashboard because the state case rate is updated only once a week and it has a 7-day lag. We need to get to 7 per 100,000 in order to reach the criteria for the red tier. Our positivity rate is 4.7. We have met the criteria by positivity because we needed to get to 8. A few things that have happened recently. One is that schools now, since we are lower than 25 per 100,000 case rate, are able to open elementary school. That is K through 6th grade. In addition, recently when we got below 14 per 100,000 case rate, youth sports was able to resume, and especially for outdoor youth sports, they are now able to play games, and of course, using the appropriate protocols and testing measures. So I'll leave the vaccine update to Rachel. So maybe we'll go to Rachel.
Hi, thanks for having me back. Well, that's good news, and hoping we have good news as we continue with vaccines. This week we did get a little bit more allocation than we have in previous weeks, so that was exciting, mainly because we did get an allocation of the Johnson & Johnson vaccine. We don't have it right now, but we were able to order it today, so hopefully next week we'll have some doses here in Sacramento County. So that gives us some more vaccine to work with. Some of our other doses were a little bit less, so we're still still dealing with scarcity of vaccine, but looking forward to having more doses and hoping with the news that's coming out of the Oval Office that we'll get to see that increasing in the weeks to come. We're still operating our site at Cal Expo, and they primarily serve healthcare, and so some of the phase 1A workers and emergency responders, and we're also doing educators there. And we just hit 26,000 vaccines there, so that's exciting news, quite an accomplishment for that team. And we also have a site now out at McClellan, and I think we talked about that last time I was here, but it wasn't open yet. So that site opened last week and just served the 65 and over population, and they're doing about 2,300 vaccines a week. And then this week we opened them to educators as well, and their capacity will increase significantly, so they should be able to get up to 1,000 a day. We're just trying to wait till we have enough vaccine. Other big changes, of course, and it will come up, I think we'll talk about it, that in the weeks to come, opening up to food, people who work in the food industry and agriculture, as well as the people that are age 16 to 64 with underlying medical conditions. So lots more people coming in, needing to get vaccinated, but we're working our way through as quickly as we can. We are continuing to work with community-based organizations to establish sites throughout the community, and we do have sites on our dashboard. Let's go to this for a second. Yeah, so we're still vaccinating, phase 1A, those are those healthcare workers, long-term care facilities. We're really still working hard on this population, and it's ongoing. And then you can scroll down a little bit. Phase 1B, working very hard for the 65 years and older, law enforcement. And then we did just open up, I believe last week, to childcare and education. So that's been great to get them vaccinated as well. So, and we will be moving to food and agriculture next week. But yeah, so working with community-based organizations, looking throughout the community to make sure we're working and representing different communities and underserved populations. So stay tuned, there's other sites coming, and we're working really hard to get those sites up and running. And we do have a map on our dashboard now. So the same dashboard that was shown earlier has a vaccine tab. I don't know if you can put that back up. But if you haven't seen it, go look at it. It's really encouraging to see how many people have been vaccinated. And then you can also see where the community-based sites are. And let's see, here it comes. So this dashboard is only updated once a week on Fridays. So as of last Friday, we were at 270,000. So that's a really awesome number for us to see. And then these are the sites, the blue sites are community sites that we have here in Sacramento. But we are working on our mobile sites as well, and really hope to be able to get out to all of those areas in the very near future. So I think you'll see some big movement in that direction in the weeks to come. And then we're still working on the transition, of course, to Blue Shield, which will be the administrator of the vaccine program for California. So that's a big change, taking a lot of time, and we're still learning some of the details, but that change is going to happen over the next couple of weeks. And then we are also onboarding, or have onboarded, to My Turn, which some of you may be familiar with, is the website where people can go on and register to see if they're eligible to be vaccinated, and if they are, they can actually find a clinic if there's one available in their community. So of course there aren't, vaccine is scarce, so it's still somewhat hard to get an appointment, but as we have more vaccine, that website's going to be fantastic so that you can go on and be able to find a location to be vaccinated. So I think that's it for my update, and then I'm happy to answer questions.
Great, thank you, Rachel. And Dr. Cohen, did you want to make any remarks before we move to Q&A?
I'll be brief because I don't have as much practical information, as you've just heard, but I thank the group for inviting me back again. I would like to echo what Dr. Kasirye said at the beginning. Our first patient was hospitalized on the 19th of February, 2020. So we have been now going 13 months since we started seeing COVID patients. Our numbers are way down. Our employee vaccines for healthcare workers have been successfully distributed to a large majority of our healthcare workers, and the number of healthcare workers who are being infected now is negligible, and the number that are getting sick is approximately zero, not exactly, but pretty close. And so we are really seeing great strides move forward. I think one of the things that we see as clinicians is, I know that there's been a lot of hubbub of about what's going on in Texas and other places around the country where they've sort of quote unquote moved on. I think most of us are feeling pretty good about how we're going. I think now is not the time to lose patience. It's been a long darn time for all of us. I haven't left Sacramento for more than 4 days in the last year and 1 month. And so it is, it's been really long and really difficult for all of us. But we're getting close to the finish line. There's no point in blowing it up before we get there. And I really urge a little bit of patience. I know this has been difficult. I think the transition to Blue Shield has been difficult for everybody. I've already seen messages about hospitals canceling vaccine, and I don't think we, at least maybe it's me, maybe it's everybody, I don't really still have a good idea as to how Blue Shield is deciding distribution and how they're working. And so the ways in which we've been vaccinating up until now may end up changing, because they may have a different plan for getting vaccine out more quickly.
Thank you, Dr. Cohen. All right, so I think that takes us to our question and answer portion of the evening. So see a lot popping up already about vaccines. So I think this gets right to what Dr. Cohen was just talking about. With all of the cancellation of appointments that we've been hearing about, should someone be concerned about their second dose appointment for this weekend at Jesuit High School?
Yeah, so, there's this larger issue, that's been in the media, particularly with Sutter, I think, having to cancel second appointments. So, and I can address that a little bit too, but Jesuit is a site that the provider who operates that site, we allocate vaccine to that provider, and they have doses for this weekend. So far, Sacramento County, we have been following the state's guidance, which is not to hold on to second doses, but to really manage your inventory so that you can meet your second dose appointments for a week. And then if you have anything left, you can schedule first appointments. So it means fewer new people get vaccinated, but more people will finish their series. And all of our providers are adhering to that guidance. And so far that's been working. It's sometimes, we're shuffling vaccine around at the last minute and really, freezers are empty and it makes people nervous, but it's been working so far. And then I would just add that we are all really trying to help as we can with the Sutter situation. I don't know, I don't have many details, others might, but public health is helping. We've given them some doses. We don't have a lot, because it's so scarce, we don't have enough to immediately make up for that shortfall. But the commitment to get people second doses is there, and there is a longer window. It can be up to the 42 days. So just like Dr. Cohen said, patience with that situation. It's frustrating for everybody, and I know people are nervous about it, but know that the hospitals and public health and the providers locally work together really well and are working hard to help with that situation.
And Rachel, maybe you can touch a little more on that 42 days, because there was another question about, if my second dose is delayed, what does that mean for effectiveness?
Yeah, so, and Dr. Cohen usually answers this one, maybe I'll punt it, but we do have good evidence now that, we do still want people to get it on time. So 21 days for Pfizer, 28 for Moderna is the gold standard, but that outside window up to 42 days, there's still really good efficacy. But Dr. Cohen, I'll let you get more scientific.
Yeah, well, I think you've touched it. So I also noticed there was a question in the chat as to if the vaccines are similar, why is it 3 weeks for Pfizer and 4 weeks for Moderna? And the answer to that one is pretty simple. That's sort of how they designed their studies. All the study designs were based on doing some early studies in small numbers of people who got vaccine, and they looked at antibody responses and targeted numbers that they thought would be protective and would be longer lasting. And so based on what they did, that's how they came up with these numbers. And as far as the exact timing, we like the timing that we have right now because of the fact that that's how the studies were done. But I suspect that even 42 days is probably not the outside window that people can get vaccinated. I don't want to make people nervous about it. And I think if you get it within the first 4 to 6 weeks after being vaccinated, it's going to be fine. Again, I suspect if it was longer than that, it would be fine too. It looks like people who had COVID back at the beginning of the pandemic that ended up getting vaccine, they have huge antibody responses, even 9 or 10 months out. So, so I think be comfortable that the timing will be good enough.
Great, thank you. And along these same lines, there's a question in the chat about the Johnson & Johnson vaccine and about it being less effective than the other vaccines, why someone would go with one vaccine versus the other.
Yeah, so that question I knew would come up. I could have predicted that at the beginning. So first things, the Pfizer study and the Moderna study were both done in the United States. Moderna may have had some sites in Mexico, but that's the only sites outside the United States. With the Johnson & Johnson vaccine, they had sites in Brazil, they had sites in South Africa, areas where some of the viruses are a little bit different, and some of these variants may not respond quite as well to the vaccine. So some of the difference in efficacy has to do with the fact that the studies were done later in the course of the pandemic, and there were more viral variants that may not be as effectively managed by vaccine. The most important message, though, is that this vaccine is still effective in over 85% of people in keeping you from getting seriously ill. People are not going to end up in the ICU. They're probably not going to end up even in the hospital. If they get infected, it's going to be mild disease. So I think, as I said, I think the first time I was on one of these panels, the reason to get one vaccine or the other is that it's available. And they're all going to be good. They're all going to protect you from getting serious disease. That's the most important reason to get vaccinated, is to keep you healthy.
Great, thank you. So the top of my list, I've got a couple more vaccine questions I'm going to go through while we're on it, and then we'll go to some schools questions here in a second. So one question is about eligibility. So you talked, Rachel, at the opening about educators and childcare. But this question is, what about somebody who holds a substitute teaching certificate? Are they eligible?
Yes, yeah, they are eligible. I think some, if they haven't worked recently, I think many of the sites we are asking people to show some verification of eligibility, and that's often a pay stub. So if you haven't been working, and you probably haven't because schools have, maybe not needed substitute teachers, you may not have a recent pay stub. So in that case, I would say before you go, make a request from your employer, a letter that they're going to be utilizing you in the school system for this coming year. And I think that would be sufficient. But yes, substitute teachers can be vaccinated.
And then another question about vaccines in schools. When will vaccination for youth start?
Well, we have to have a vaccine approved for the youth. Dr. Cohen, do you have thoughts on that?
So Moderna and Pfizer both already are doing clinical trials in, so Moderna's trial is age 12 to up to 18, so it's 12 to 17-year-olds. And since the Pfizer vaccine was approved for 17 and above, their study is 12 to 16. Those studies are already being enrolled and being done. I also know that our site, and I'm an adult infectious disease doc, so I passed it on, but our site was approached by J&J to do a pediatric vaccine as well. So kids will be a little bit behind, and the younger kids below age 12 will probably be the next cycle. So this is going to be catching the tween teen people, and then the younger kids will go in the next cycle after that. But the vaccines have to be approved for them before they can get vaccinated.
Thank you. So Dr. Kasirye, you mentioned in the opening a little bit about eligibility for schools to open and how elementary schools are currently able to open based on our adjusted case rate. We've got a few questions in the chat related to Folsom Cordova Unified School District's recent request to open their grades 7 through 12 middle schools and high schools. Can you talk a little bit about why that's not able to happen right now?
So I'm not going to be able to talk specifically about any school district, but I will give a description of the process. So there are a couple of things about school reopening. One of the points at which schools can reopen, which is probably the cleanest and easiest, is when a county goes into the red tier. When a county is in the red tier, any school can open from anywhere from K through 12. Over time, the state has developed additional processes that could help some schools to reopen if they meet certain criteria, or if the county meets certain criteria. One of those is a waiver process, or where they what happens in those situations is if a county gets below, the case rate gets below 25 per 100,000, they're still in the purple tier, but they can, the schools or the school district can submit for a waiver and submit a protocol to the county that's reviewed by the county and also reviewed by the state. And if the protocol is deemed to be sufficient, then they get approval to open K through 6. In January, the state also introduced an additional process called a safety review. And the reason they did that is that in January, I think it was January 14th, the state changed their criteria. And so some schools that, and their guidelines, so some schools that were already open or were in the process of opening, if you looked at the new guidance, they would not be able to remain open. So that is why the state created that process. So some schools that had, and I'll give an example, is some schools that had reopened or were in the process of reopening, if they were not able to meet the 6 feet of social distancing, that they could request for a reconsideration and show what measures they were taking to make sure that they created a safe environment for the students and teachers. The other was also if some schools were in the process of reopening, but because of the changes that were occurring in the January 14th guidance would not be able to continue. No school in Sacramento County was in the process of active reopening in January because we were in the purple tier. So there is no school in Sacramento County that met the criteria for that special process, the safety review. And so the best is that right now we have a lot of schools that have submitted for being able to open K through 6. And once we get to the red tier, which we're hoping will be soon in a couple of weeks, once we get below 7 per 100,000, then all the schools will be able to reopen all the way up to 12th grade.
Thank you, Dr. Kasirye. You covered a few of my questions here, so that's great. So along these same lines, there's a question about concerns about mental health of students due to school closures and lockdowns, and where Sacramento County Public Health stands on adjusting guidelines to allow schools that are ready to receive students. And then from the same person, whether Sacramento County Public Health has plans to adjust guidelines for schools to allow them to open prior to a waiting period after the actual change in tier.
We have to abide by the state guidance. We are not allowed to be more lax than the guidance that is given by the state. So we do not have the liberty to be able to make any changes to the guidance. But the state recently did make a change where as soon as we get to the red tier, the next day, the schools can reopen. So that's what we have been telling our superintendents, that they should be ready. In order for us to change to the red tier, we need to meet the criteria for 2 consecutive weeks. So the first week that we meet the criteria will be a heads up to all the schools that the following week they will be able to reopen. So we continue to provide updates to the superintendents, and as soon as we are aware that that change is going to happen, we will let them know.
Okay, and you mentioned a little bit about the red tier, and there's another question about that. So counties in the Bay Area like San Francisco, San Mateo, and Santa Clara have moved to the red tier. What are they doing right that we're not doing?
That is really based on county metrics. There are a number of issues that have led to some counties being able to move a little faster than others. And some of the criteria or the factors are beyond our control, but what we're trying to do is to continue encouraging everyone to remain vigilant, to follow the protocols we've been advising, which is face covering, hand washing, 6 feet separation, avoid gatherings. And we are heading in the right direction, especially with also the more that we're able to vaccinate. And I think that we will get there in a couple of weeks.
And another tier question here. There's been some information in the news lately about the state making some adjustments to their tier system based on vaccination rates. And the question is, how will that affect Sacramento's tier status?
That announcement was made today, and basically what the governor said, or the state said, is that if we, because we're all monitoring, of course, the number of vaccines that are given and the vaccination rate in especially some of the hard hit or underserved communities. So what the state decided is that if we get to the point where we have 2 million doses given in certain zip codes that are selected based on certain criteria that determine that they are underserved, that then we will, and this is at the state level, that the state will adjust so that we can get to the red tier with a case rate of 10 per 100,000. Depending on when that happens, it might help expedite our going into the red tier, or if it's going to take more than a few weeks, we might get to the red tier before that change is made.
Right, thank you. So we have a few more questions about accessing vaccine here. This person asks, if we are helping a senior, what is the best advice to give them? It seems like the first of the week at McClellan had lots of openings and then they filled up by the end of the week. Is it best to try on Mondays?
Can you hear me? I'm not having great internet. Yeah, so I think McClellan releases those appointments on Sundays, and because they weren't filling up when we were just having 65 and over there, we did open it up to educators. So I think it has made it probably a little bit more challenging. So I would try Sunday, but also we have a website, Sac County does, that has a website specifically for seniors that has lists of sites that you can go to, as well as pharmacies. Walgreens, Rite Aid, CVS, Safeway, they all have vaccine. And you know, seniors are eligible. So the website's a really great spot to go because that's kind of your one stop. It's got everything on it. And I think just continuing to be persistent and trying to find appointments. And if you click around, there's usually something in there, but you may have to keep at it.
Great, and here's another one. I'm 61 and I have underlying health conditions. Do I need to bring a note from my doctor to demonstrate this risk in order to be vaccinated?
So starting March 15th, we will be opening up appointments for those with underlying medical conditions that put them at risk for severe complications due to COVID or at high risk for death. We've had a lot of discussions about this. It's easier if you are able to get your vaccination from your healthcare provider because they will already have your health record. But we do understand that a lot of healthcare providers do not have access to the vaccine, or it might be difficult for you to get an appointment. And there are also a lot of people who don't have a healthcare provider. Maybe they lost their job, lost the insurance, so don't have a healthcare provider at this time. In Sacramento, we have made the decision that it will be an honor system. So when we get to that point, when you are registering, we will ask you certain questions and you will have to attest to how you meet the criteria in terms of, is it by age, is it by occupation, or is it by health condition? We do not ask for specifics because we do understand the sensitivity of some of the health conditions. So in other words, we will not require a note from the doctor in order to get the vaccination.
So we have a couple of questions related to kind of some changes at the state level in terms of vaccine. One about when will all the scheduling for county vaccine supply go through the state scheduling system? And then also questions about how the move to Blue Shield, the third-party administrator, might affect vaccine in Sacramento County.
Do you want to start, Rick?
We are going to have to see.
Rachel, I think you're breaking up a little bit.
Yeah, I'm frozen. Can you hear me?
Yeah.
Yeah, we can hear you.
Okay. You know, we onboarded to My Turn. That's the state scheduling system. So we're ready to go to apply it to a larger venue. We're just, we're not feeling quite comfortable yet because it doesn't work. Right now, our clinics are targeted towards very specific populations, and the My Turn system is completely public, and there's not an option to do that. So I think in the weeks to come, we're going to make that transition. We're just trying to figure out how to do it in a way that helps us to maintain our second dose appointments, which are really important to us, and also still keeps the right people coming to the right sites for vaccine. And then, Dr. Cohen alluded that we don't have a lot of information from Blue Shield. So I think that's been a really tough one for us. We wish we had more details. We hope things will just continue to flow, but we don't know. Right now, the doses that are in Sacramento County outside of the hospital system come through public health, and then we allocate them to the providers that we have relationships with, and we've been continuing to bring providers in, but we had to stop doing that because we were making this transition. So we're not certain. Maybe in 2 weeks on this call, I hope we have more information. We're still waiting to hear.
Great, thank you. And here is a question about accessing vaccine. Somebody says, I have a friend that is eligible for vaccine, but they don't have internet. Is there a phone number she can call to make an appointment?
Sure. So we're working on a couple of options right now. One is we're working on a contract with 211. And once that is finalized, we will publicize it so that people know that they can call and get assistance from there. Then for some of, especially pop-up clinics, we are working with community-based agencies and people from the community to help with doing the outreach as well as helping people sign up for those clinics.
All right. Does anybody want to take a guess at or make their best estimate of vaccine availability for young adults, let's say ages 20 to 40?
You mean when will it be available?
Yeah.
Dr. Cohen, do you have any idea?
You guys run it. I'm going to guess at least a month, probably late April, beginning of May, right? Once all those added doses that the government bought get out, I think you're going to be looking at the younger folks, as long as they don't have underlying illnesses. So if you have a 25-year-old with cystic fibrosis, they will be in the next tier, right? And that's the other point. But younger people under age 40, it'll be late April, May. Total guess.
Do we have any information on variants here in Sacramento County?
Yeah, so we have a little bit on variants. One of the ways that we have this is we've been doing asymptomatic testing at UC Davis of our healthcare workers, and on the main Davis campus, they've been testing employees and students for months now. And when we identify now a positive, we are doing genetic testing on the virus that's identified to look for some of the variants. So we've seen a handful of the B117 variant, which is the one that started in Great Britain. And we have seen a significant number of the so-called California variants. At least in our lab, we have not seen the P1 variant from Brazil or the B1.351 variant from South Africa. I know the state also is doing a lot of testing through a variety of different ways, and I think it's very similar. My understanding is that there have been some B1351 seen in other locations in the state, but I don't know whether Dr. Kasirye can tell us whether they have any more information through what Sacramento County has done. But the variants are around, that's for sure, but it's very small numbers right now.
No, we don't have any additional information. Right now, our public health lab is not doing that genetic the sequencing. We might be doing it in the future, but right now we just send our specimens off to the state, and so far we have not had any positives yet.
Yeah, another question about vaccine. I know we've talked a lot tonight about the scarcity of vaccines, and this question is related to, I think, some recent announcements about 100 million new vaccines in the next month or two, and kind of if that's the case, what will that mean in terms of getting more vaccine out?
I'll tell you one thing, I think Rachel will be able to sleep a lot better. Because I think one of the hardest things we've had is making those decisions as to who gets how many doses and making sure that we have enough vaccine for our needs, and also being able to respond to questions that come in about people wanting to have the vaccine, and very frustrated, and understandably so. So I think it would be great if we could get enough vaccines so that people can go and have several options, just like we would for the flu vaccine. That would be great, because then most people would be able to go to their own healthcare provider, their own doctor, to get the vaccine, and public health would focus on the underserved and those who don't have a medical home or don't have access. But right now we are trying to do both, trying to provide vaccinations, especially as we've been doing the occupational sectors, but at the same time also trying to make sure that we start providing vaccinations to the underserved, because these are the ones that were hit the hardest with COVID-19, highest numbers of cases, highest numbers of deaths. And so trying to cross out the doses and trying to make decisions as to how many clinics you can have makes it difficult, because the other thing that would happen also is we would be able to do long-term planning, because usually during the flu season, at the beginning, we decide how many clinics we're going to get. We're able to publish it, publish the site, so everybody has enough time to plan and know which clinic they would go to. Right now, the way we're doing it, because we get weekly allocations, is once we know our allocations, that's when we set up the clinics for the next week. So it does make it very difficult, especially for those that have additional barriers to being able to get places, being able to access computers.
All right. So a question about, I know this is Johnson & Johnson vaccine has been in the news a lot lately. So this question is, will the Johnson & Johnson vaccine be available at community centers, particularly the vaccination site at Natomas High School?
So I can't say for sure. We got some doses this week. It's not enough to send to all the sites. And there are some specific applications that we think are good uses for Johnson & Johnson, because it is one dose. But you likely will see it at some community sites. You may see it at a provider's office as well. So as with the Pfizer and the Moderna, because we have scarcity now with all three vaccines, we evaluate really carefully the sites that we send them to make sure they can store and handle them correctly, and that it's the best use of that particular vaccine at that site.
The J&J vaccine can be refrigerated, right? And so that makes it able to be distributed to smaller offices or places where they might not have quite the same ability to store the other 2 vaccines.
Then we have a kind of a longer term question here is what's the projected timeline for when we might reach herd immunity in the United States? What would that look like as far as getting back to normal life, which all of us, I think, are ready for?
Yeah, so I don't know if I can talk about normal life. I'm not sure I've ever lived a normal life, but let's just say that that we want to get up to about 75% of our population that are immune either through infection or through vaccination. And so I can't remember all the exact numbers of the number of people who have actually been infected in the United States at this point. But if you look at that and you probably multiply it times somewhere between 5 and 10, because there are a bunch of people who are infected that never got tested. And then you add up all the people that get vaccine. I'm going to say that hopefully by the beginning of the summer, we should be getting to that number. Now, what defines normal is something that we've been discussing even within healthcare. You know, yeah, the restaurants will be open. You can go and eat. You can go to a gym. You go to a movie. You can go to theater. You can see a concert. All the stuff that we're sort of missing. But you know, I still wonder whether there will be people who will be more comfortable wearing masks, just as a matter of fact in cluster type circumstances or on an airplane or somewhere along the lines. Because, you know, one other thing that's happened as a side effect of all the social distancing and masking is the number of cases of influenza that we've seen at UC Davis is down almost 85% from last year. And the number of other respiratory viruses is, I can't think of any right now, or at least they're awfully few. And so there are a lot of pluses to some of the strategies that we've implemented now. And I think some of that may carry over, but big picture wise, I think the kinds of stuff that we're missing right now are actually seeing people face to face, where you can actually see their whole face and not just their eyes. And I think that we hopefully will get to that point. I would hope by summertime.
Thank you, Dr. Cohen. My daughter's already declared she's just going to wear a mask for the rest of her life. So,
for some of us, it may actually make us look better. I think I'm starting to think that I'm more appealing with a mask on.
It really does force you to focus on the eyes. So along these same lines, you know, will there be a time where we'll have an idea whether COVID-19 is kind of a one and done deal, or if it's more like the flu where we have an annual, you know, kind of season and maybe an annual vaccine and all of that?
So I'm not a seer into the future, and so I'm not going to be able to totally say this, but I think it is going to be more like flu. And the idea might be that we get vaccinated annually. It may be every 3 years. It may be every 5 years, like with or things like tetanus or pertussis, where it's a little bit further out. But I think we're going to end up seeing this again. This is a highly adapted virus that I don't think is going to just disappear. I wouldn't be surprised, to be honest, if things, if we don't get people vaccinated fast enough to keep these variants totally in check. I wouldn't be surprised if people end up getting a booster even within the year to address some of the variants. The vaccine companies are already studying vaccines with these variants, trying to pick which one should be the target for the vaccine. And ultimately, the vaccine may be like flu, where there may be 2 or 3 viruses within the same vaccine. So I think you can expect that it's going to be a repetitive vaccine. I'm hopeful that it's not going to be annual, but it'll probably be some cycle time to be revaccinated.
And I think this is along the same lines in terms of how long we'll have to be wearing masks. A question about should we be wearing 2 masks?
Yeah, so that's an interesting question. I think this was raised based on some studies that suggested that maybe some of the cloth masks in particular weren't very good at filtering particulates and might not be quite as effective. And that sometimes with some of the surgical masks that we have, they don't fit very effectively on your face, right? I mean, people like me that wear glasses, if I'm fogging up my glasses, there's not a particularly good fit there, and there's still potentially ways in which things can get by. So one of the arguments for double masking, if you're using a surgical mask, which is graded effective enough to do the filtering, is that the second mask, the cloth mask on top or something else, is actually pushing the mask down so that you get a better fit, and that and then it adds an extra layer. I think if you get some of these cloth masks that have triple thickness, you probably don't need a second mask, but it may be more effective. And I think that this was raised recently because some of these variants are more easily transmissible. And so it may require less virus to get through the mask to be able to infect you. And so I don't wear 2 masks personally because I use a regular surgical mask that fits acceptably. But I think that it's a perfectly reasonable thought, particularly if you prefer using cloth masks.
How about 3 masks? I'm kidding.
Well, eventually you start putting enough stuff on that it makes it hard to breathe, right? That's the balance.
Yeah.
Right? You don't want to pass out from having too many masks on, right?
Fair point. So we do have a few questions about vaccine eligibility. At what point are library staff eligible, or what category are they in?
We put library staff among educators, so they're eligible now.
Great. And what about somebody who's age 50, presumably without underlying medical conditions? Would they be eligible at the same time as somebody who does have underlying conditions, or how does that work?
If they do, if they belong to one of the occupation sectors, then yes, they would be eligible. Otherwise, they would have to wait.
And then in terms of the underlying conditions, do we know what conditions would qualify somebody when that does roll out, in terms of certain, somebody asked about disabilities, would mental health issues qualify somebody?
I haven't memorized the list, but I believe we do have it on our website, and we can also make sure that we post it. Most of them are, as Dr. Cohen mentioned, some of the chronic lung conditions like cystic fibrosis. It also includes certain developmental conditions. It includes people with Down syndrome. It does include, there's a category for people who, they don't list a specific disease, but if it's determined that getting COVID will impact their ability to access services, then they would qualify as well. So, Rachel, I don't know if you remember any more.
You know, I'm in the same boat. I was like, oh, I know there's a list and I read it, but you know, I don't have it memorized either.
So we have a couple of questions. Oh, I think we have some visual coming up here. Thank you, Liz.
That's it. Thank you.
And it looks like that's available online there at covid19.ca.gov. We have a couple of questions about multisystem inflammatory syndrome in children. One is, do we have any information about how common that is here in Sacramento County? And also, we have a parent that says their kids are scheduled to go back to school later this month. Should they be worried about that? What are the risks of their child acquiring that?
So regarding the county information, I'll leave that up to Dr. Kasirye. And I'm not a pediatrician, but I do know that our my colleagues in pediatric infectious diseases at Davis have been seeing cases, not large numbers, but they have been seeing cases of MIS-C. In fact, we've actually seen one adult case that is clearly the same multi-system inflammatory process that is seen in kids. This was a younger adult, but they do occur. So, so it's around. It's not particularly common. And regarding the risk in school, the majority of kids are going to do well. And I think if there is at least some attempt to mask and distance, and there's some way to make sure that there's at least some ventilation within the rooms, I think the risk is comparatively low that your child's going to end up with MIS-C.
In Sacramento, we've had, during this period, we've had just one report of a child that fit the criteria.
A couple of questions about individuals who are fully vaccinated. One, do they still need to follow all the precautions that we've been talking about for the last year? And two, is testing still necessary for them?
So I can take that at least in part. So first, I do think that they still need to take the precautions. I think at the end of the week, which is tomorrow, I think CDC is going to come out with some new guidance in relationship to vaccinated people. And if you were in a room with one other person who's been vaccinated, I think you can toss your mask and visit like you would beforehand. But I just remind everybody that the majority of the population has not been vaccinated yet. And it still isn't clear that these vaccines totally prevent infection, even several weeks after the second dose. And so it is still possible that you could transmit to somebody else. So I think within small groups, it probably is safe to be unmasked. I think from the big picture, I think it's still better if, particularly if you're out in public, to be following all the standard guidance to prevent transmission of COVID-19. What was the other part of the question, Nick?
Testing, would somebody who's been fully vaccinated still need to be tested?
So it all depends on what kind of work you do and what kind of things you do. We're still offering asymptomatic testing to our healthcare workers. We're not requiring anybody to get tested, and the uptake is relatively low, but we do find some positives. And as I mentioned, that's how we know what variants are circulating. So I don't think that it's necessary to do weekly testing for the majority of people who have been vaccinated, but there may be certain circumstances where it makes sense. And if you actually have symptoms, because the vaccines are not 100%, you absolutely need to be tested.
And I think this is kind of along these lines. Do we know when updated guidance regarding visitation at long-term care facilities will be available that take into account vaccination of residents, staff, and visitors? This person says they have a 92-year-old parents are both in an assisted living facility, and the director at the facility has said they're waiting for guidance from public health before changing any visitation practices.
Yes, and usually we have to wait for guidance from the state. So we're hoping that it will come soon. We know that the guidance in place right now is still dependent on case rates. And since we're still in the purple tier, that means it's still very restrictive. But we're hoping that soon, especially since long-term care facilities have were the first ones to get the vaccine, that that will be taken into consideration. And actually, I do have to point out that since the vaccination started in the long-term care facilities, the number of outbreaks has gone down markedly. So that's a testament to both the fact that we've passed the peak, and also the fact that actually the vaccines are protective. So we're waiting. Hopefully it will be soon.
So Dr. Kasirye, I think some folks might have missed the earlier conversation about school reopenings and that process. And we've got a few more questions here, so I wanted to touch on that. There's this one asked specifically, there've been a lot of stories in the news about, each district announcing their reopening plans. And so this person asks, I've heard that students in one district are going back in early April. Why can't the students in another district that we won't mention, grades 7 through 12, why can't they go back too if they're in the same county? Why are things being done differently for those two districts?
It helps if I unmute. As I mentioned, it all depends on the criteria. Right now, while we're still in the purple tier, the schools are only able to open elementary schools. And so there are a number of our school districts that are going through that process. I believe that the reason that there was an announcement about some schools opening in April, that was based on negotiations with their teachers' unions and other staff. And with, of course, the hope that we will remain in the red tier, or that once we are in the red tier, that they will make sure that they're able to start reopening, because once a school has started reopening, even if we are to revert, which I hope we don't, that they would still be able to continue the process. So I think that's basically what it is.
Yes, I believe those announcements are based on the assumption that, that hopefully they will be eligible to open those schools at that time. So this is a kind of a follow-up on the discussions we were having about boosters or the different manufacturers of vaccine. How do we make sure, as boosters are developed in the future, how is somebody going to make sure they get the right one? Like, what if they forget which manufacturer their first dose was from, or their first 2 doses were from?
Yeah, that's an excellent question. And, I just say, I got a call this morning from a physician who was talking about somebody who got the first dose of the Pfizer vaccine and then mistakenly got the Moderna vaccine as their second dose and asked whether they should get another dose of vaccine. There are no studies that have been done to determine whether getting 2 different brands will make any difference. We also know we're doing a clinical trial with the Novavax vaccine, which likely will be the last of the cluster of 4 to be available through emergency use. I'm assuming probably sometime by the end of April. And but when people have been in the trial and they get offered emergency use Pfizer or Moderna vaccine, we haven't had to unblind them, and they may be getting 2 different brands of vaccine. I think in the long run, it probably is not going to make a big difference. We need data to specifically state that, but I think the likelihood is they all target the very exact part of the coronavirus to engender the immune response. And so with that stated, it probably isn't going to make a huge difference. But I'll be interested to hear what everybody else has to say about that. We want people to get what they got, second dose, and the first dose should be the same. But downstream, we may find out that they're like flu vaccines. One year you may get one brand, and the next year you may get the other brand, and they're all similar enough that it doesn't make that much difference.
So we have a question related to a recent report.
Before you move on, I think Rachel was going to say something.
Yeah, I'll just add, my internet's kind of in and out, but I would just add that when people do get vaccinated, they get a small card that is their vaccine record, but the vaccines are also mandated.
We're losing you, Rachel.
We're gathering the data on sorry, can you hear me?
We got you now.
Okay, which is where we're gathering data on immunization rates. And so that registry, you can go online and request your record, or you can ask your medical provider, or public health can help with that. So there is a record somewhere. We do, and Dr. Cohen's point is great, and hopefully it will be, and taken up. There is a record. It can be found in the registry.
Great. Okay, so I'm going to do my best to get this one. So there was a recent report in the New England Journal of Medicine, and it's related.
New England يقول إن له علاقة.
The report was related to skin reactions that appear to resemble an infection somewhere between 4 to 11 days after the first injection, and an average of 8 days. And some people experiencing a delayed reaction after a second shot. Does anybody know much about that or want to speak to that particular study?
Yeah, so this is a smart group. You have this call, and because that paper came out earlier this week, and
جاء الدراسة في نهاية هذا الأسبوع.
and some people have been calling it Moderna arm, and it's a delayed local reaction to the vaccine, sort of like when people's arms hurt after they get vaccinated. So it's related to the immune response. It's not an infection. You don't need antibiotics. Most of these, a lot of them are itchy. So antihistamines and sometimes just topical steroids like hydrocortisone are enough, and it goes away, and people don't get seriously ill, and it should not deter anybody from getting vaccinated. And if they got a rash the first time, there's no guarantee they're going to get it the second time, but it still shouldn't keep them from getting the second dose of vaccine. They have a lot of nice pictures in that New England Journal paper if you want to look at it. It looks, they're sort of big, what we call plaques. So they're slightly elevated, and they look like a really large hive for anybody that's had hives. And I think it probably is a similar kind of thing as getting hives.
So we have a question about testing. This person observed or has heard that testing has gone down and that positivity has decreased, and curious how that might change testing resources. Does that mean closing of testing sites or a centralizing of testing? Any information on that?
At this time, we're not planning to make any changes to the testing sites that we have available. We continue to monitor on a regular basis to see if there is a need to make those changes. But right now, we still feel that we're still in that uncertain period, and it's too early to start reducing the number of sites.
We have a few more questions and statements about school reopenings. One about American Academy of Pediatrics, a recent policy statement that the safety protocols should determine school reopening, not community case rate. And then kind of the idea that schools should be the priority for opening over businesses. And so maybe somebody could talk a little bit about how those decisions are made and the role of Sacramento County in making those decisions versus the role of the state.
Decisions and guidelines are made at the state level. Basically, what the counties are doing is we're just executing the state health officer order and following the guidance that they provide. We can be stricter, but we're not, we do not have the liberty to be more lax than the guidance that the state provides.
And then there's a few more questions in the chat about specific eligibility based on particular underlying conditions. So I know Liz is answering some questions behind the scenes, and if you haven't already, maybe we can get the website posted where we have more information on underlying conditions and what how those might qualify somebody for vaccination. Here's another, oh, here we go. Liz looks like it's sharing that again. Thank you. And so question about surveillance testing. Are we going to be doing any widespread surveillance testing in the future to get a better idea of prevalence of the virus in the community and percent of immunity in the community?
I believe what the person is asking about is antibody testing. I know that it has been done by the state and some universities, probably in some areas, not the entire state, because that would be a daunting task. I don't know if Dr. Cohen has been involved in any of those studies.
No, it's difficult. And I think there was another question that I saw in the Q&A about actually getting tested after the vaccine to look for immunity. And, you know, right now, there are a couple key points. So some of the antibody tests that are available actually test a different part of the coronavirus than what is in the vaccine, and therefore the test will be negative and it will fool people. I had one of my colleagues call me after he'd been vaccinated asking why he never got any antibodies. And I asked him first, who ordered the test? And then second, which test did they order? And when I ordered the right test, he had antibodies. But these tests right now are what we call qualitative, meaning they give you a plus or a minus as an answer. What would be better is something that's quantitative, that can give you a number that tells you it's high enough that you're actually immune. So I think part of the reason that we're not doing testing is that we don't have the clear parameters as to what's necessary for getting for being immune. So for example, when you get hepatitis B vaccine, if we test for antibodies to hepatitis B, we know there's a number, right? Anything above 10 million international units per milliliter is immune. Anything less than that is not, and may require further vaccination. We don't have that information yet. I think it would be great to start doing serosurveys, and I think it would be great to get an idea as to how broad the immunity is. And I'm sure these studies are being done by epidemiologists in a variety of different states. It will be very helpful to everyone to have some idea as to how much immunity is available. But I think the testing has to become a little bit more sophisticated now, looking at case-by-case basis.
Okay, this question is, how are efforts to reach the African American community going, and how are you getting information to them?
Those efforts are just starting, just the same as with any of the other neighborhoods and underserved minority communities. And the way that we are doing it is mainly to work with the community-based agencies and also people that are from those communities that are regarded as leaders or have been working with some of the underserved communities. And we're still in the process of developing that plan, but basically it will consist of developing or having pop-up sites in different areas, and we will make those decisions based on the feedback that we get from the different communities.
Right, and somebody asks about the process for getting in line to get a extra dose that might be at risk of being wasted if at the end of the day at a clinic.
I can answer that one. So all of the sites who receive vaccine from Sacramento County are expected to follow the state's guidance on extra doses, which means they do need to go within the phases and tiers and work their way down to find someone who's eligible. And I think right now our sites are using those doses for second doses. We reach out to people who need second doses. So, you know, I think there's an idea that there's a big list and lots of people waiting. We're pretty careful to only take out the vaccine that we can use for that clinic exactly. So if there's an extra dose, it's just it's a few, and there's usually second dose people or someone that's waiting for an appointment that we're able to get in.
And we have a couple of questions about youth sports. Would my child be safer in the classroom or playing a contact sport with contact against others, sweating and breathing in close proximity? And also, why are we moving forward with youth sports if there is no vaccination for youth at this time?
First of all, the youth sports that are being allowed right now, it's mainly the outdoors sports. And then also they have to follow certain protocols. There's still some restrictions, and for some of the, especially the more high contact sports, they will require testing regimen as well.
All right. A couple of hanging questions. Quite a few folks very interested in the Sutter health issue and the cancellation of second dose appointments. So I'm going to categorize these into two themes here. One, who should I blame? And two, what can I do? You can skip to two if you want.
I can start. Hopefully my internet will hold out, and Dr. Kasirye, you can add, or Dr. Cohen. You know, blame is, I'm not sure if it's really an issue of blame. It's such a tough situation where we don't have enough doses, and originally providers were shipped their second doses and told to hold on to them. And that was the original guidance. So people started this kind of backlog of second doses. And then the state changed the guidance and said, only keep what you can use in 7 days, balance them out. Second doses need to be given. And then if you have anything left, use first doses. I think that we're seeing kind of the perfect storm right now where all of those second doses are coming due. The guidance was about 4 weeks ago, and we're seeing this with some providers. So I think Sutter's trying really hard, and I know they've reached out to their patients and do plan to reschedule them. They were able to get some vaccine, and that's going to help. Other providers in the community want to help. Sacramento County Public Health is helping coordinate that. So I think the priority is to get those patients their doses. So again, patience is needed. There's a window. So we know that even though if it's due today, that there's still that window to 42 days. And I have every confidence that that's going to happen. If you were a patient at Sutter and you haven't received an email, you know, I guess acknowledging or I think they're going to reach out and tell you how you can reschedule your appointment. Dr. Kasirye, I think in our calls with them, that's what they said. So I think those people are going to be vaccinated, but it will take a little bit of patience, and we just don't have enough vaccine, but it's coming. And that's the priority right now for Sutter patients to get the second dose.
I agree with what you said.
Okay, and with that, it looks like we are now over time. So I just want to note that tonight's session was recorded, and we will be sending out a link. So if you'd like to relive the last hour and a half at any time in the future, you can do so by viewing that recording. Also, there'll be a survey so that we can get your feedback. If your question wasn't answered tonight, again, you can email us at COVID-19, COVID-19, no dash, at saccounty.net. I would like to again thank our panelists, Dr. Kasirye, Dr. Cohen, and Rachel Allen, and all of our interpreters, Kayla, Alexander, Miguel, Laura, Tyler, Angela, Ahmed, Cindy, and Jordan. Thank you again, everyone, for joining us, and have a great night.